Hello everyone, I'm Darlene Young from Arlington, and I'd like to welcome you back for another segment in the Mindful Health Alternatives program here that shows on CAT TV every month, and we're on channel 15. The goal of this series, as I've told you before, is to introduce you to a more healthy lifestyle and to give you ideas on how to lessen stress in your lives. Our guests today are Melanie Letourneau and Rob Green, who will be introducing you, our viewers, to Apitherapy, which is the use of products from bees as medicine, including venom, honey, pollen, royal jelly. And we even have live bees here on the stage today, or on the set, and Rob eventually will be stinging Mel, and it's really good for gout and arthritis and several other maladies that we have. So I'm going to turn the program over to Rob and Mel and ask them to introduce themselves and to tell you how they became involved in this type of apitherapy and a little bit more about apitherapy itself. Thank you.
Well, I'm Melanie Letourneau, and I am a work in progress. I am someone who has been a beekeeper for about 8 years now and use apitherapy because I have these issues that I'm trying to heal naturally. And I look to Rob Green for my information.
As she said, I'm Rob Green. I've been keeping bees for, I think almost 20 years now. But I got into beekeeping primarily because of all the problems people have from ingesting too much sugar. But I have a sweet tooth, so I had to do something, so I decided that honey was maybe the answer. And over the course of years, I've gone from learning how to keep bees and try to keep them alive, and to that, and there's several directions you can go from that part of beekeeping, and one of them is apitherapy, which is, as she mentioned, is using beehive products to help people with health issues. It also works on animals, pets in particular, horses, of course, most any mammal. Apitherapy itself is the use of all these beehive products in harmony with nature, and it is a complementary medicine. It's also a green medicine, which is of interest to some people, of course. Apitherapy has actually been around for a long time. There's recordings of writings, I should say, not recordings, but writings of apitherapy being used over 5,000 years ago. It was used extensively by the Greeks back in the days of Hippocrates and some of the other ancient writers. The Egyptians used a lot of apitherapy products for treating different things. Most of the mummies they used some of the beehive products to encapsulate the bodies to help them, to preserve them for a number of years, a lot of years. Interestingly, in one of the tombs, they found a pot of honey with an infant submerged in the honey, and the body was maybe obviously it was deceased, but the body was intact. Honey is one of the foods that never spoils, about the only food that never spoils. So even if you have a jar of it in your house or wherever you, refrigerator or on the counter, wherever, and it crystallizes, it doesn't mean it's bad. That's just a normal thing that happens with any supersaturated sugar solution anyhow. But with the honey, you can eat it like that, or you can warm it up and liquefy it. Some of the products of the hive that you may or may not be familiar with. Honey, of course, everybody knows about honey. Pollen is another substance that the bees bring in. The bees, of course, visit flowers, and anything that flies gets an opposite charge, electric charge to the ground, basically. And as they come into a flower or blossom, and their wings are buzzing, and it vibrates the flower a little bit, and the pollen comes off and sticks on the hairs on the bee. And the bee will comb the pollen off from those hairs, and it'll bring up a little bit of nectar and form these little nuggets. I don't know if you can zoom in on that or not, but and then they carry that back to the hive. Other thing in the hive is one of the things they bring in is a substance called propolis, which is a combination of various different things. A lot of it is tree sap, or when trees bud, when the buds start coming out, there's a substance right near the bud that the trees put out to protect the bud basically from other insects. And the bees collect that, mix it with other stuff, and bring it into the hive, and they use it for basically sterilizing the inside of the hive. They coat the whole inside of the hive with it to create that sterile environment. If they should happen to sting a mouse that may have crawled into the hive and kill it, of course they can't drag the mouse out, but to prevent it from putrefying, they encapsulate it with the propolis, and that prevents that, of course, from happening. Propolis happens to be the strongest natural antibiotic, and we'll get into some of the uses of propolis. Royal jelly is another product of the hive that most everyone has heard about, and it's used, of course, for feeding the larva initially, and that's what the queen has fed her whole life. And it is that diet of royal jelly that takes what normally would be a worker bee and turns it into a fertile female queen. Of course, beeswax, as everybody knows about beeswax as well, and that's used, of course, in a lot of different areas. Most of the cosmetics, lip balms, sort of such things have beeswax as one of the ingredients. And of course, the bee venom itself is used for treating all sorts of different health issues. Some of the conditions treated by the bee stings and by these other products are things like MS, arthritis, nutritional deficiencies, wounds, pain, gout, shingles, burns, tendinitis, aging, infections, and also as performance enhancers. And that's, as I said, that's pretty much what all of the different products are used for in specific applications. Honey is, I'll talk about honey first off, and honey is basically the stored energy that bees use for their everyday existence, really. For us, it has a number of benefits besides being something sweet to eat that you can put on ice cream or cereal or whatever. But honey also it has a soothing effect. It's an antioxidant. It helps with the assimilation of food. It enhances the growth of infants. And a lot of it, about 1 million tons of it, are produced every year. Some of the attributes of honey, it's antifungal, antibacterial, antimicrobial. It normalizes digestion. It's a light sedative. It's a gentle diuretic. It calms nerves. It has some antioxidant properties. It's a hydrator. Use it for skin conditioning. It's also kind of a sealer, and it's very easy to digest. It doesn't need anything else for digestion. Everything it needs that we need to digest it is part of the honey. So it's probably the best sweetener that a diabetic person could take, obviously in moderation, but it doesn't produce the high spike in insulin need that sugar produces. It's more of a slight increase, and then it's kind of flat lines out through until the honey is consumed. Honey is kind of an amazing substance in harmony with other elements. It has some other specific applications where it's very effective. Some years ago, there was a Dr. Jarvis in Vermont who did some experimenting with honey and vinegar. I think he originally started out as he wrote a couple books on it as well. In one of the books, he talks about using it and mixing it into feed for a small herd of Jersey cows that he used as his experiment, and their milk production increased by a substantial amount. And from that, he decided to start using it on some of his patients and had interesting results from that. Also, typically it was a teaspoon of honey for a tablespoon of vinegar in an 8-ounce glass of water. And he suggested taking that after every meal to help with things like weight loss and digestion issues. For arthritis treatment, it was a little stronger honey solution, a cup of honey with 3 teaspoons of vinegar. And then you take that at like 2 teaspoons before bed, and he said if you had trouble falling asleep, take a couple more teaspoons. Pollen is another amazing thing that the bees bring into the hive. It is basically the bees bring it in, and that's their meat and potatoes. That's where their nutrition comes from. They mix it with honey, and it's kind of an amazing, as I say, an amazing substance. It contains basically every element that's in our bodies, and in substantial amounts. It's a real strong or high-level bioflavonoid, has high antioxidant capability, and it contains all 22 amino acids that we need for our existence. I have a chart that I can't show you right now, but it shows the comparison of oxygen radical absorbent capacity of pollen compared to most everything else that is claimed to have high capacity, and it far exceeds everything on the list. The pollen itself is, of course, is dust, but it's each plant has its own specific pollen, or I should say, each plant has a very specific pollen granule. The shape is quite different from plant to plant. Also, these little granules have a hard shell, and to digest them, they need to be in water for a while before we ingest them. Another substance in the hive I mentioned briefly before is propolis. The bees collect this for, as I said, for sterilizing the inside of the hive, or creating a sterile environment inside the hive, encapsulating things that might putrefy and cause a problem in the hive. They also use it for stiffening the structure of the honeycomb. They look for a honeycomb that vibrates at a certain frequency, and they use a little bit of propolis to stiffen the comb up. Propolis is also the strongest known natural antibiotic, which is pretty incredible, really. And honey and propolis together will kill even a MRSA staph infection on a human or an animal. I've seen this firsthand numerous times, and it's pretty incredible. It will clean out a staph infection, almost overnight. A couple days, there's no more sign of pus. Within a week, usually it's mostly healed up. Especially in younger people, they heal pretty fast, but an older person, it might take a little bit longer, but it's pretty incredible how quickly it actually works. Let's see, what else can I say about propolis? Some of the other properties of propolis, it's an anesthetic. It's about 3.5 times stronger than cocaine, over 5 times higher than, like Novocaine. I guess it's Procaine that they actually use now. It's an immune system stimulant. It stimulates cell building. And one of the things that's been interesting to me, at least for most of these beehive products, is they never stay the same. They're constantly variable. Every year the bloom is a little bit different, and all these beehive products come from plants, of course. And different things, the bloom is a little different every year, and the bloom is different from early in the summer all the way through the end of summer. So the honey, the propolis, the pollen are infinitely variable, and it makes it impossible for a bug like MRSA or other staph infections or some of these other bugs that are out there. It makes it impossible for them to mutate and become resistant to it. They just can't mutate that quickly. Another beehive product that has had some notoriety is royal jelly. And as I mentioned before, the royal jelly is fed to all the eggs early on as when they hatch and become a larva. The first 3 days or so, they all get royal jelly. But the queen is the one who gets royal jelly all her life, and it's really the royal jelly that makes a queen a queen. It works on the DNA basically, and because the queen is just a completely different critter than what the worker bees are, even though they all start, the queens and the worker bees start out as the same thing. For human consumption, royal jelly is claimed to be a rejuvenator. So it slows aging. It also works on the endocrine system, which is most of our glands. So it's a kind of a difficult thing to produce. There are not many people in this country who do it because it's so labor intensive. Basically, you've got to trick a hive into thinking it's got a bunch of queens to feed, and only bees that are 6 to 11 days old actually produce the royal jelly. So you've got to keep a lot of young bees in a hive. So you've got to constantly be changing the population of the hive in order to maintain a production of the royal jelly. So consequently, most of the royal jelly that is sold is produced in China. They evidently have low cost labor available, and that's where most of it comes from. Beeswax is another product of the hive. Beeswax is obviously that's what the comb is made of in the beehive, that holds the honey. It also holds the pollen, and of course all the what we call brood, which is all the eggs that turn into larvae, into pupate, and then they go through metamorphosis into an actual bee, or housed in the wax. The wax is used for a variety of different things, from most of the cosmetics that women use contain some wax. Lip balm, things as simple as lip balm, hand lotions, salves. There's a number of different products out there that have beeswax in them. And then lastly, I'm going to talk about bee venom. Mel's all excited about that. Bee venom, of course, it's a natural product. And again, it's very similar to the rest of the beehive products. It's infinitely variable. Again, it's produced by the bees, and they produce it from the different things they ingest. So it's different, a little different every year. It's a little different from early in the summer to late in the summer or through the winter. And again, it's pretty impossible for anything to become or to mutate and become resistant to it. About the only other venom that is similar to bee venom is cobra venom, but the cobra venom effect doesn't last as long as the honeybee venom does. It's a little bit of a mystery on totally how the bee venom works, but as best that has been determined at this point, there is a direct reaction to a bee sting right in the area where the sting is. Our body will produce cortisol, which everybody knows about cortisone, which is synthetic cortisol. But the cortisol that our body produces doesn't have the nasty side effects. So this is very effective on things like arthritis, joint pain, even on shingles, which is kind of surprising. Something that hurts as bad as shingles, and you put a bee sting on it, that sounds pretty cruel, but it actually reduces the pain. Mm-hmm. The bee venom therapy was started in Vermont here back in the 50s by a fellow by the name of Charles Mraz up in Middlebury, and he basically went on the theory of if there's a spot that hurts, you sting it. But since then, it's branched out a little more into following the acupuncture points, where acupuncturists put in the needles. These points seem to be the most effective for treating different issues. The bee venom also causes a systemic effect where the immune system is shifted into a higher gear, if you will. It typically will give people more energy, more strength. Basically, it improves the blood circulation. So it's all the things you can think about how a bee sting reacts from any bee is similar. Honeybee venom just reacts a little bit differently. It stimulates a lot of the glands in the body as well. And it's used in a lot of different clinical fields. It's used in the vascular system fields, neurological, immunological, rheumatological, dermatology, infections, ophthalmology, veterinarians use it. There are some contraindications for bee venom, things to stay away from. If you have any kind of psychiatric conditions, endocrine conditions, either hypo or hyper, infections, TB, STDs, ulcers, liver cirrhosis, somebody who has clinical depression, anxiety, and of course if somebody's unwilling, it's not a good idea to sting them. If anybody's on a beta blocker as well, it's not a good idea. If somebody has an allergic reaction to a bee sting, you can, such an EpiPen can be used to counteract the reaction to a bee sting that somebody who's allergic to it. But if somebody's on a beta blocker, then the EpiPen won't work. So it's kind of a good idea to stay away from them if you're on beta blockers. One thing I forgot to mention, the use of these products on animals, probably the most noteworthy is the use of pollen with racehorses. Pollen acts like a steroid, as well as having all the amino acids. Animals and athletes as well who consume large amounts of pollen find that they oftentimes, if they compete in an event, sometimes the second and third run are faster than the first. The bodies seem to be able to recover quicker. The lactic acid that builds up in muscles is dissipated more quickly. Most of the Olympic medalist athletes consume large amounts of pollen. It is a steroid as well, and but it's a legal steroid, so it increases strength, increases muscle building capabilities, that sort of thing. So I've jabbered on quite a lot here, and that's a quick brush of what apitherapy is all about and what it can be used for. And Mel has volunteered here to receive a bee sting, so we're going to demonstrate that and see if I can get only one out of here.
Yeah, please, just one. They've been sitting in the heat, so.
Yeah.
And just so you know that I've been using bee sting therapy. I was on statins for years, or for a long time, for arthritis or for high blood pressure, or cholesterol, and it caused a rheumatoid arthritis in my joints. And I haven't been on medicine in 8 years. I quit just before I was a beekeeper, and I don't have any arthritis or any rheumatoid issues at all anymore. And I'm really just procrastinating here, avoiding this bee sting. What he's going to do, and I don't know if you guys can move the camera in closer or not, he's going to sting me in the arm, and can you see that really close? And then the stinger is going to remain in my arm, and he's going to show you how it works and how to take it out and all of the above. But you're only going to get one shot at it, I promise. Okay.
One of the interesting things, to me at least, about when you sting somebody with one of these little critters, is that the stinger, even though it pulls out of the back of the bee, it continues to pulse, even though it's not there anymore. So it's like it's its own little organism. So
Just go for it before I change my mind and make
Okay.
Darlene or somebody else come up and do that.
sometimes we get a dud here, and they don't
You have a dud.
have a dud. Come on. Well, I brought another one out just for that purpose.
This one is not a dud.
That's not a dud.
And here's the stinger in my arm. And ouch, see it move? I'm going to scream uncle here in a moment. And then Rob is going to take that. Oh, he has to dig out a credit card or something. Make sure you get the number on his credit card when he does this.
I'll use my I'll use the card that I use for getting into work.
Okay. And he just scrapes it off like that.
Oh, except
Well, maybe.
there we go.
And now you can see the red spot on my arm. And the stinger is dead. It's just kind of extra stuff there. We just move that out of the way. Really move that out of the way. And now I've been stung by a bee. In a few minutes, I get stung a lot, not because I do this, I don't volunteer a lot, but because I'm in the bee yard a lot. And I don't really swell up as much as most people would, because after you do it so many times, you get kind of used to it. But you can see my hand here, my arm is getting red, and if you touch it, it's a little bit warmer. And it will continue to swell for about 10 minutes or 15 minutes, just like if you stepped on a bee out in the yard. But what will happen is that tomorrow it will start to itch, and that's okay to scratch it, right?
Well, it depends on the level of scratching.
Okay, yeah, you don't want to
Yeah.
make yourself raw.
If it gets real bad, if you feel like you're going to rip your skin off, you put Preparation H Cool Gel on it.
I never knew that. Just kind of dealt with it.
Now, what was your sensation? I mean, did it hurt?
Yeah, it hurts. It hurts like a bee sting.
Just like
And
outside?
even though the stinger is gone now, I can feel it kind of, it still feels hot, and it hurts a little bit right now. But if you walk around with something like gout or arthritis, a bee sting is nothing compared to some of the pain that some people are going through. And when I touch it just now, I rub my hand on it, it's a little painful.
Yeah. The kind of an interesting thing is especially compared to other insects that you might get a sting from, is typically a honeybee sting. You get a fairly sharp spike in the pain, and then it tends to drop off and taper out, or drop off and taper off. Something like a yellow jacket sting, it peaks and stays up there longer.
And it has no medicinal value, so don't go out and look for yellow jackets. It's not a good idea.
So basically, the only bee that you can benefit from is the honeybee?
Well, I recently read an article on that said that any sting is beneficial.
Really?
Or can be beneficial. Yeah. And I think it's, again, because of the way our body reacts to it. There's the body goes into alarm state. Oh, I got a wound here, and so it'll accelerate your defensive mechanisms, your immune system, basically.
Now, one of the things, this propolis, is I eat this, and that's okay to eat, right?
Oh, yeah.
Good, because I chew on it once in a while. Years ago, a beekeeper told me, and it might have been you, that if I have issues with canker sores in my mouth or any kind of issues in my mouth, that if I eat some propolis or chew on some propolis, it would be helpful.
Yes, some of the other things I didn't mention about propolis is it also is one of the few things that is effective on Crohn's disease and diverticulitis. Mainly, you eat the chunks like what are in this container here, and ingest it, and it goes through as fairly sizable chunks, basically, and it gets down into the digestive tract where the problems are, and it's still very effective down through there. And chewing it. If you have a toothache, for instance, if you chew it, the toothache will just go away.
Really?
As long as it's in there. But if you've got a structural tooth problem, of course, it's not going to fix that.
Yeah.
But it may help, with the pain until you can get to a dentist who can take care of it.
Now, as apitherapists, do you sell this or give it away, or what?
Yeah,
if somebody came to you and, you know, was interested in, you know, being, how do I want to say, worked up to see if bee stings would help their arthritis or something, would you go through a whole process with them to find out whether they could undergo this therapy?
Yeah, it's a pretty extensive interview process. It digs into a lot of stuff that maybe the individual doesn't want to get into, but it's important to find out what kind of medications they've been on, what sort of other problems they've had in the past. There's a whole list of medications that are, you know, don't work because, you know,
They're
causes
indicated,
exactly,
yeah.
exactly. I had a fellow come to me a couple of years ago who had a problem with a knee, and I started stinging him, and you know, the typical interview process, and didn't seem like he had anything that was too much of a concern. So I started stinging him, and there was no response. Basically, it just didn't do anything. It came 2 or 3 times, and finally, the 4th time he came, he was acting quite a lot different, and come to find out, he was a heavy pot smoker, didn't want to stop, and an alcoholic as well. And so those are 2 indications that, you know, I said, well, you got to make a choice. Basically, either you get off that stuff and we do this bee sting therapy, or you continue with your recreation.
Right,
you know?
right.
You know, just.
Yeah. Now, with the pollen, you had said that it has like cortisol effects, and like athletes can take it because it is a legal steroid.
Yes.
Does it show up in the blood if they do tests and stuff?
Evidently not.
Really?
Evidently not. At least not. It's not the ones they're looking for.
Yeah.
You know, it's a
now, what
natural
did they
product.
do? I mean, how did they ingest it? Just like take a spoonful of it?
Sure.
And
You can ingest it, you know, with food, by itself, with liquid, however you would like.
From personal experience, it's easier just to take it and then chase it down with some water. I'm not somebody who likes the taste of pollen. I have a grandson who will eat it by the spoonful.
Really?
Oh yes, he's 2.5 years old, and he will just scoop it out and eat it. He loves it. But from personal experience, I think the first thing someone said is mix it with honey, and it just ruins my honey. It's just a nasty taste.
Yeah.
But it's just easily dissolves. It just dissolves right in your mouth, and what can you say? It's all natural. It helps with mental clarity as well. I notice that if I take pollen in the morning and I go to work, that my concentration is better, that my ability to articulate what I'm trying to talk to people about is a little stronger, a little bit more on target. I'm not saying that it's just the pollen. It could be the coffee too, but I think it's mostly the pollen. Sure. I do.
Well, like we had spoken before we went on camera, it started the program. My mom is a firm believer of using honey and lemon for colds or, you know, whatever happens in the winter time. And if she has a sore throat, she'll start with the honey and lemon. And like Rob said, it has a soothing effect, and it really works. A few years ago, she had pneumonia. And the first thing she did was start with her honey and lemon, and, you know, she was starting to feel better, you know.
Yeah. Yeah, that's an old-time remedy for sore throats and colds and stuff. Yeah.
One of the things that I learned recently is that if you put honey in coffee or in tea and it's more than 120 degrees, I think it is, that you're killing off some of the good medicinal properties of the honey. So you always want to make sure if you buy honey that you're buying cold-pressed or cold-spun honey, and that you don't heat it to more than 120 degrees, which is really kind of a bummer because I like it on my coffee, but I like my coffee hot. And that's, I've tested it, it's more than 120 degrees.
Yeah.
Boy, you could swallow something that hot.
Yes.
Now,
typically they say that if you can drink it, it's cool enough so the honey won't be affected. But if you've checked it at 120,
I have. I've checked the coffee at 120, and it's kind of warm for me. I like it right out of the pot. Just yes, it's terrible.
You had said, like, with the honey, you know, like everybody basically can use it. Somewheres along the way, while I was reading up on apitherapy and stuff, sometimes little children aren't given honey.
There's in this country, there is a caution put out by some medical doctors that infants under a year old should not be given honey.
Okay.
Because there's a possibility the honey might have a botulism spore in it, and the infants, their digestive system hasn't developed enough to handle the botulism spore. It doesn't bother us. Interestingly, though, this is the only country in the world that says
It does that.
Yeah,
Wow.
and there's so many other places where they can be ingesting botulism spores off their toys, off their, crawling around on the floor. I mean, there's a lot of other sources.
And there's never been a case of a child getting botulism from honey.
Okay.
Yeah.
Now, with the bees that you had taken out with your forceps, did they die after they stung, Mel? Or
Yeah. Well, they'll live for a little bit afterwards, but they're doomed. They will
Are
die.
they really?
Yeah.
Okay.
Yeah. One shot. They can sting animals and each other multiple times, but when they sting a person, the stinger is pulled out of the back of the abdomen, and they walk off and die.
So normally the stinger stays with them if they sting each other or sting
Yes.
an animal? Okay.
Yeah, our skin is just the right texture, so the barbs from the stinger get caught in their skin,
Wow.
and it pulls it out. Yeah.
Yeah, because they're over there and I can hear them buzzing all the way over here, and I'm thinking like, okay, are they upset because, the lights are on them, or, what are they doing?
Yeah. Well, they might be just scenting as well.
Yeah.
That's one of the things the bees in the hive do, is they operate off scent as far as different activities that are going on in the hive. That's what controls them. The queens put out off a certain scent as well. If the bees are lost, they'll put out a certain scent to try to attract the bees from their own colony,
really?
to say, this is where we need to be, or that kind of thing.
And
Now,
when they
this-
sting,
Yes.
there's also the pheromone
Oh yeah,
that's
That
given
comes
off,
out, too.
and that's what's driving
Yeah.
them a little crazy
Okay.
now.
yeah. That's like a target.
Yes, it's like
Now, is it fair to ask, are these like worker bees that are in
Yes.
there?
Yes.
Okay.
Yes. Yeah.
And the queen is probably still back in the hive.
I hope so. Yes.
We hope
Yeah,
so.
yeah. Now, how many hives do you have, Bob?
Right now I have 2. We've been having problems with overwintering bees in the last couple of years, and so you start out with 6 in the fall, and 2 survived. No, it's not what we hoped for, but at least 2 survived.
Now, Mel, how about you? How many do you have?
I think I have 25.
Do you?
Yeah, we're just having more and more children all the time. We just can't seem to stop.
Wow. Well, I really appreciate you two coming to visit with us today and to let us know about apitherapy. It's fascinating. It really is. And there are other segments of different
See this.
programs with bees too, besides the apitherapy.
Oh, absolutely.
Oh,
This is
absolutely.
just one direction. Yeah.
Okay. So will you come back another time,
Oh,
please?
Sure.
Would be nice.
Great. Well, do you have anything else you'd like to share? And
I'd like to show you my bee sting now that it's swollen into a real bee sting. You can call me tomorrow and see how I feel.
okay.
Yeah, it looks like a mosquito bite with a little red around it.
Yeah,
basically.
and just not swelling up. Some people, and that is one thing that we should talk about, is that if you've never had a bee sting before and we go to sting you, your whole arm may swell up, and that doesn't mean you're allergic. The allergic part is when you can't breathe and you have issues like that. But if there's something, when I first got stung, now I have the diabetes. I'm a diabetic, not insulin, so don't worry. And the first time I got stung, my whole arm turned red and swelled up, and that was really quite ugly.
How long did it last?
About 2 weeks, actually.
Really?
I was like, oh. And it was what we call an accidental sting, which is how most of mine come. But after a while, it's gotten so that it's not as bad. Hurts just as much.
Yeah. Typically, when someone comes to me for bee sting therapy, the first sting is what we call a test sting.
Which was like this.
Actually, it's shorter duration than that. They basically would let the bee sting and then immediately scrape the stinger out. A full bee sting is only a few micrograms of venom. So if it's in just a short time you scrape it out, it's even a minute part of that. And if somebody is going to have a problem, though, that is enough to show.
Right.
But it's a small enough amount, so hopefully you can get them to a place of help if necessary. I should say that the incidence of someone being allergic to honeybee stings is very, very low. Very good. I've been stinging people now for, I'm not sure how many years, 10 or 12, maybe 15, and I haven't seen anyone with an issue. I know that you talked about the first time you got stung. The first time I got stung, I had this is before I started Apitherapy, I had gloves on and with a kind of a mesh net around the wrist for ventilation. And it was against my skin, and the bees, or a bee came and stung, and there was immediately a whole gang of them that came. I must have gotten stung, I don't know, 6, 8, 10 times right in the same spot before I got things under control. And I also had a big water sac on my arm for about 2 weeks like that.
Did you really?
Yeah. But since then it's been, very minor reactions.
Now, the water sac, it was caused by the bee sting? And
my body's reaction to the bee stings, yes.
Okay, so your body just reabsorbed the water afterwards?
Oh, yes.
Yeah, wow.
Yeah, well, and as Mel mentioned, the only thing that is, when somebody's having a problem, basically they can't breathe. There's a few other steps along the way before you get to where they can't breathe that you watch for when you sting someone. But basically they get real antsy, they can't sit still, they're just, acting a little crazy. And then the next thing that happens is they actually have an anaphylactic reaction and
Wow.
have trouble breathing. But,
Now, when you were talking about the bee venom, you likened it to, like, was it cobra? Now, the bee is less than the cobra, because aren't cobra bites like fatal? Or am I barking up the wrong tree here?
It's certain, but it's with a cobra bite, you're getting a substantial dose of venom.
Yeah.
When they treat people with cobra venom, it's on the order of a bee sting size amount.
Okay.
So but that's the they've tried all sorts of different venoms for treating different things from different critters, and our reaction to venom is the cobra is closest to the way we react to honeybee sting.
Wow.
Honeybee venom.
Now, in your notes, you also mentioned bee bread and bee air.
Yeah, there's a whole bunch of other side things that I didn't know there would be time to get into. But basically, bee bread is what the larvae are fed, or what the bees actually eat. It's a combination of honey and pollen that is put in a cell and then capped with propolis. And then as they need it, they take it.
Okay.
And that's kind of an interesting substance to eat as well.
Yeah.
And that comes out of the comb or out of the hive?
They store it in the comb,
Okay.
in individual cells. It's
Okay.
brown-looking stuff, and but it has some interesting capabilities, qualities of itself. Bee air is the aromatics that come up out of a hive. The hive is the cluster is maintained at about 94 degrees Fahrenheit year-round. So there's just a natural flow of air through the hives, and when you're working a hive, you take the top cover off, all those aromatics are coming up, and they've been proven to be very effective at treating things like asthma in particular. Yeah, I know every year when I first get into the hives and I start breathing that, I get a very pronounced cough that I wondered, geez, I didn't know I had any issues, but I think it's a kind of a cleansing that's going on.
Yeah. Oh, wow. This is really fascinating, you guys. Now, one more question, and then you can talk some more about different things if you want, or we can just wrap it up. When you went to the hive to get these guys, okay, did you have to smoke it? I mean, every once in a while you'll see a program where they're smoking the hive in order to, and wearing these bee suits?
I wore a bee suit, but I did not use smoke.
Okay. Right.
Yeah, the bees, and it has of course it varies with weather and time of year and all that, how the bees respond when you go into a hive. But gentleness is paramount. If you approach the hive slow, calm, gently, they're not as aggressive. If you are clumsy, bump the hive, agitated, the bees pick it up, and they'll come after you.
Wow.
And when we smoke bees, we're not killing them or being mean to them. What we're doing is we're telling them there's a fire somewhere in the hive. They go down and they eat the honey, and they prepare to swarm.
Okay.
In layman's term, or in third grade level language. And what happens is when they eat the honey, they fill their abdomens up, and when they fly out, it's harder for them to sting us.
Oh, wow.
So that's why we do that. We don't do it to be mean, and we don't. I've seen the bee movie. It's not true.
Okay. Good.
The other thing that part of it as well is that when the bees are in that mode, they're in a survival mode. So they're not going to go be aggressive and sting.
Good.
Right.
Yeah.
Well, I'd like to thank you both again for coming to visit with us today and to enlighten us about bees and their properties and what they can do. And, I'm really excited to get you back, too. So I want to thank our viewers for tuning in today to see our production on apitherapy, and want to thank Rob Green and Mel Letourneau for being here with us today. And stay tuned for more programs on mindful health alternatives. Thank you.